I'm Christine Colella, and I am an adult nurse practitioner, and I direct the nurse practitioner programs, and I do primary care. I see patients every Friday. I work at Lincoln Heights, which is a federally qualified health center, and I do total management for my patients, whether they come in with high blood pressure and need their medications started or managed or reevaluated, or they come in with a sore knee or a rash and says, "What's this?" So I do a little bit of everything, which is really tough in primary care.
Can you tell me some about your roles and responsibilities as an advanced practice nurse?
There is an immense number of responsibilities as an advanced practice nurse, and I think one of the many roles is the blending of the nurse, the nurse that we are, with the provider component. And I think that's why nurse practitioners are as good as they are, is because we do blend those both roles. So I take the responsibility of educating my patient about why they're doing something is as important as figuring out what medication to put them on. Because you can put them on the right medicine, but if they don't understand why they have to take it or what it's doing to the physiology in their body, then they're not going to understand why they need to take it every day. And it's going to mean that they may say, "Well, I don't know, this doesn't mean anything, so why should I take it?" And I can't tell you how many patients say to me that they hear my voice in their head, you know, when they're going to take a medicine or not take a medicine or make a decision. So it's really, really important that we take that nurse component of the educator and making the patients understand, looking at the patient in totality, and the provider piece where we know the physiology, we know the evidence, we know the pharmacology, we can bring all that together and blend both of those roles that really makes a difference in the everyday life of a patient. We can write any script, but it means nothing if the patient isn't going to be able to do what we're asking them to do. So all those things that we hold dear to us as nurses, worrying about culture and family and community and having the patient be knowledgeable, really come together and make us as good as what we are as providers.
Can you tell me how you use biostatistics to influence your professional practice and patient outcomes?
That's a great question. You know, people might not think that they use biostatistics, but we use it every day. Every time I make a decision, every time a drug rep comes up to me and says, "Hey, would you use my medicine?" And I can look at that handout that they give me and look at the information that they are giving me, and I can turn around and I can say, "Well, what about this? What about efficacy? What about that?" And I can bring all of those terms that you think you'll never really use in biostats, and you find them coming out of your mouth, asking them more questions about how good a medication is, what the response is, what, you know, you really use it when you go and look at a magazine or a journal, and you want to understand whether or not the choices that you are making from a management standpoint. You look at the stuff that's out there, and if you don't think from a biostatistics standpoint, even though you may not be aware that you are, but if you don't think about it from that scientific, solid, critically an investigation standpoint, you're going to miss the stuff that really works. And you're going to go off and say, "Oh, well, I saw this on TV, so I should order that for my patients," when that's not what you should be doing. You should be thinking about the evidence. And, you know, statistics is, as much as we may, you know, pull our hair out sometimes with it, it truly does. It's kind of the bottom line, because it really and truly helps us make the right choices. And being an advanced practice person, that responsibility, that's why, you know, we've all gone back to school to do advanced practice, is we want more responsibility. But if we want that responsibility, we must hold it very dear to us and make the best choices that we can. And that's where biostatistics comes in, because you're really utilizing that information to make you a better provider by making better choices for your patients. So it all comes full circle as far as I'm concerned.
Okay, what else do you think would be important for graduate students to know about biostatistics as they become advanced practice nurses?
I think that what as they become advanced practice nurses and as they are practicing advanced practice nurses is not to abandon what they've learned. You know, sometimes students, we all do it, we learn what we need to learn for the test, and then it kind of leaks out our ear as we sleep. But what we really need to do is stay on top of what we learned, because you never know when you're going to have to reach into that bag of tricks and pull it out. And, you know, I've heard myself saying to patients things, you know, about statistical studies and what it means, and part of me is looking at me kind of chuckling, going, ha, well, you know, your biostatistics professor should see you using these terms. But it's really something that is always there, and we may just need to, you know, tip our hat to it and say, wow, this is something that's important, and I am going to use this. And it's all about the understanding. It helps you understand. And as far as I'm concerned, we can go off, I mean, you can go off rote, you can go off memory, but that never replaces understanding. And that's, the more you understand it, you can change the terminology. You're not going to talk to patients in biostatistical terms, but if you understand it, you can translate that to English that the patient can understand. And it makes a difference. I had a wonderful discussion with a patient one time. I was getting a little irritated, but she kept quoting me all this stuff that she read on the internet from just some random internet page. And why she liked what she was telling me was because it was biased towards what she believed. And it was wrong. I can't remember exactly what the topic was right now, but it was not correct. And so I kept trying to, you know, show her, get her to understand the correct evidence, the studies, where you go on the web to find stuff that is important. And she kept going, and finally I kind of threw up my hands and I said, so you'd rather believe something on the internet that, you know, has no statistical or no evidence to it than someone sitting in front of you who's educated? And she looked at me for a minute, and then she just burst out laughing, and she goes, you're absolutely right. I have no business looking out. She goes, I was just looking for something so I didn't have to change my habits, kind of thing. So it was great. It was a perfect example.
That's fine. Try not to laugh. That's really good.
It is. It's great. It really happened too.
Is there anything else that I need, or that you would like to share?
Just embrace this. I know it's hard. We've all been through it. It doesn't seem like it makes any sense, but it really, really does. And just, you know, take a deep breath, embrace it, and there's so much for us to learn. I mean, there's not a day that goes by that I don't learn like 20 new things, and I think, oh God, how could I be so stupid not to know that? So this is just another, we've got a lot of space up in that brain, and this is something that you really want to embrace is the best word I can use, because you really want to wrap your arms around it, understand it, and then tuck it away, because you're going to find yourself pulling it out, and it's going to be coming out of your mouth, and you're going to be laughing at yourself going, where'd that come from? But it really, really isn't an everyday kind of thing.
All right, well, thank you.
You're welcome.